Well, contact tracing is one of the most powerful tools in the fight against the coronavirus. But a new national study by National Public Radio shows that most states, including Minnesota and Iowa, actually don't have enough people to do that work. KIMT News 3's Raquel Hellman is looking into the issue. She joins us now live in Rochester to explain. Raquel.
Yeah, George, this map from NPR shows which states meet the estimated need for contact tracing. So yellow actually means the state does not meet the estimated need. And as you can see, there is a whole lot of yellow, and that includes both Minnesota and Iowa. But before we can really understand why so many states are falling short, we first need to understand exactly what contact tracing is. So I turned to the experts.
If I were to develop COVID-19, the idea would be that through the public health infrastructure, they would say, okay, in the last 14 days, who have you been in contact with? So you can imagine how difficult that is and how much labor it takes to do that.
According to this NPR survey, there are just not enough people to do that right now. The National Association of County and City Health Officials estimates 30 workers per 100,000 people are needed to do contact tracing during this COVID-19 pandemic. And this survey finds Minnesota only has about 1.8 workers per 100,000 residents. And after seeing this NPR survey, I reached out to the Minnesota Department of Health to get some answers, and they tell me the results were taken a bit out of context, and that's because these questions were asked early last week, and of course this is a constantly evolving situation. So Department of Health officials sent me a statement that says, in part, at the time NPR was soliciting information from states, we had adequate staff assigned to contact tracing, and MDH was not actively hiring contact tracers, in part because of a hiring freeze in the state and because of our plans are to reassign existing state employees to do the work as the need grows. And he says they've been continuously adding staff to do the contact tracing as the caseload requires, and they're actually pulling qualified staff from all areas of the department as needed. The state is also working with local public health departments to start using their staff for the contact tracing as well. Live in Rochester, Raquel Hellman, KIMT News 3.
Thank you, Raquel. The NPR survey shows Iowa has 36 contact tracers with plans to hire about 200 more. That means they would have about 7.5 contact tracers per every 100,000 residents. That is more than here in Minnesota, but still well below the 30 workers the National Association of County and City Health Officials estimates is needed during this coronavirus pandemic. On that note, let's take a live look from high above Rochester this evening.